Hey, how's it going, Doctor? How are you today?
I'm doing great. How about you?
I'm fantastic. I get to sit and talk with you and pick your brain. So, I mean, let's start off with the big questions here. Uh, can you tell us a little bit about mental and physical health disparities in the Latinx community, and what are some of the root causes of these disparities?
Yes, sure. Well, in the Latino community, the two most, in my opinion, important disparities is access to care and utilization of services.
Mm,
Latinos, both in terms of accessing care for health in general, and specifically also in mental health, they are known for decades to uh, underutilize services, and the two main problems are that they don't have as much access to care, and also that they once they get into the doors of service, that they utilize the services. And there are different reasons related to that. One that we have been, well, actually, we use a mnemonic to that help us remember some of the root causes. At least we said that issues related to uh, health and mental health in Latinos are related to the 5 A's. So it is accessibility, is appropriateness of services,
mhm,
is affordability of services, and is uh, advocacy,
mhm,
and it is availability of services. So
mhm,
those are the 5 A's. So Latinos, like other populations, but for example, here in California, uh, we comprise about 40% of the population, and about 40%, 50% of Latinos speak Spanish at home, for example. And therefore, the availability of services in Spanish provided by bilingual providers is of critical importance because, as it happens, for example, there are studies that show that up to 75% of Latinos that get into the doors of service don't return for a second time. And why are those reasons for them not returning? It has to do with culture and language primarily. There are other reasons, but those are the two very important ones. So, and this takes me to appropriateness of services. That if the services can be provided in the language, and they see that their culture is being considered, there are cultural cues that are of critical importance. For example, you walk into an office and you don't see any signage, or you are not greeted, or there is
mhm,
no conversation, let's say in Spanish, or the pictures don't relate in anything to you. It's unlikely that you are going to feel that's a welcoming environment. And
mhm,
if there is no, small talk or chit chatting with the receptionist, that is also a signal that may not be as welcome.
mhm,
So those are very important things. The other thing is affordability. We, for decades, Latinos tend to have the lowest rates of insurance, both medical insurance for health services and for mental health services. So just not having access to care because they are low in affording the services is a big issue. Finally, the other issue is, or two issues, is accessibility. That there are, a good proportion of the population, sometimes they don't have transportation, and going to for services may take public transportation. I have known of cases that it takes them a couple of hours to get to the services are. And sometimes when they get a little bit late, then they are not seen anymore because
Mm.
they say your appointment was at 3 p.m. and it is 3:15. You missed the opportunity. Finally, the other one is advocacy. That navigating the health systems is pretty challenging sometimes because the paperwork that needs to be done, because the fear that they are not going to be understood because people don't in the office don't speak Spanish, for example, if the person is a Spanish speaker, that if they come with family members, I had used to give clinical services myself, and it was not uncommon for the mother or the father or one sibling to come with half of the family. So in the waiting room, there might be sometimes two or three people, and sometimes receptionists are not as sensitive as they could possibly be, for these nuances, for example.
Hmm. So, we talk a lot about mental health on this show, and you are an internationally renowned expert on mental health in ethnic populations. You conducted the largest mental health study conducted in the United States on Mexican Americans. What made you interested in the research, and what were your findings?
Well, thank you for that reference. Actually, now it used to be the largest study ever done in the U.S. in people of Mexican origin, and it was funded, that study, in the middle of the 90s. It was funded by the National Institute on Mental Health. And now is the second largest because there is another study that was done nationwide with
Wow.
bigger numbers. But it continues to be the largest, specifically on mental health, with seasonally employed migrant workers. For example, we have
Mm.
a comprehensive uh, study that we were able to do, and we look at things like frequency of mental disorders. Uh, who was using services if they needed them, who was not using services, who started to use services and they stopped using services, and also what is called risk and protective factors. What are those factors that are associated with having certain mental disorders? For example, we know that depression is more common in women, substance abuse is more common in men, and so we also study the studied risk and protective factors. That is very important because it gives us a sense of where to look at, and what are the kind of things that can give us in clinical practice an idea of questions that we can ask, and otherwise we wouldn't ask them. Um, the findings that I can share is, and what we reported actually has continued to be reported after almost 30 years, and and that is that when it comes to people of Mexican origin here in the U.S., in particular of Mexican origin, is that the U.S. born tend to have higher rates of mental disorders, for example, substance abuse, anxiety, depression, than those who were born in Mexico. And
Mm.
those who have the lowest rates of mental disorders are precisely the seasonally employed migrant workers. However, an important finding for us was that uh, there were tremendous differences on who is utilizing services. For example, the US born 1 out of 3 who are in need of mental health services because they suffer from depression, anxiety, or suffer from substance abuse. And sometimes that, along with diabetes or hypertension, we call those comorbidities, the co-occurrence
Mm.
of mental disorders among themselves, but also with physical conditions. And what we reported, for example, that 1 out of 3 of the US born were using any kind of service. And I can speak about that just for 1 minute after I tell you a little bit more. 1 out of 6 of those who were born in Mexico were using services, and less than 1 in 10 who were needing services of the seasonal and employed migrant workers. This is 1 in less of 10. That's very, very low use of services. And one of the great things that it was a great experience for me is that when we came up with those results, and there are other important findings, we had a chance to create a model to increase access to care to the low income, primarily rural populations that were way underutilizing the services. And there are really good reasons why it is important to provide timely, appropriate services. One of them is that Latinos are notable, for example, to go and seek services when they are falling apart. They wait too long,
Mm.
and they go to the emergency services. And we know that the services that they can get in the emergency room are 10 times more expensive than the services that they can receive in an outpatient manner.
Right.
And also they tend not to be as effective. So there are economic reasons why it is important to provide services in a timely, comprehensive, cultural, linguistically sensitive manner.
Mm. And so, you not only did the research, but you found a way to actually translate that science into policy change. Can you tell us a little bit more about that? Because that's like superhero stuff right there.
No, no, you are very kind. No, it is just to really put whatever research results we find into practice. It is the commitment to not just leave it as part of an interesting article that goes into the shelves and gathers dust, and no one, remembers that. The challenge for all of us is to, as you well said, translate those findings, that information, into policy and into practice. And in our case, we have worked with, for example, with legislators, with policymakers, with administrators to increase the opportunities to improve access to care and utilization of services. Right now, for example, we have been working for 5 years, a little over 5 years, in a county-wide system in Solano County, for example. They asked us to come in our center and help the county to improve access to care for Latinos, Filipinos, and LGBTQ populations. And they show us the data that there was underutilization of services by at least by Latinos and Filipinos. And they ask us, we want to work together along with our community partners to increase access to care and utilization of services. Fast forward 5 years, and I'm very happy to tell you that we have some really good positive results, which is possible when we come together, and we coordinate, and representatives from different sectors, from the county services, community services, but also representatives like, for example, churches, schools, social services, law enforcement, transportation. When we come together and figure out ways in which we can coordinate these efforts, that positive results can come about.
All right, so I have one last question, and it is the question that I ask everyone who comes on as a guest for this show, and that is, where are you finding your joy these days?
That's a great question. Especially under this era of COVID. And I can tell you, I have no question responding to you. One of the silver linings of COVID for me has been getting closer to my family. I have, my wife and I have been married for almost 50 years. We have 4 kids, all of them adults, and we have 5 wonderful grandkids. And this has brought us together. Actually, we had been so much in touch with one another. And I'm actually moved to tell you that thankfully, my oldest son, his wife, and there are 2 kids, the smallest of the 5 grandchildren live here in West Sacramento. So we are right in the same vicinity. And now we are able to hug each other. My wife and I are vaccinated, fully vaccinated, and they also are taking themselves very, very careful. I mean, they are staying safe, and that allows us to come and get together. So one of my joys is just to be with family. I love music as well. I'm a music lover, all genres. I enjoy Celtic music. I love to read as well, Andrew. I can tell you that since I was a kid, reading captured my imagination. I could travel in my mind when I was a kid, and now, before COVID, I was traveling a lot because I do work with the World Health Organization and the Pan American Health Organization. And now I can tell you that I'm a part of this incredible initiative sponsored by WHO that we call the World Mental Health Survey Consortium. And I'm on the executive committee right from the beginning. We started on 2000. Now I'm coordinating all of the participants of Latin America and the Caribbean. And I travel a lot. But I can tell you, I don't miss travel. I love to stay put and to be in touch. I have been calling friends, childhood friends, that I haven't seen and haven't been in touch for over 50 years. And that's what I do on Sundays or Saturdays. I took my time to really be in touch. And it's just been wonderful to be able to do that.
Absolutely, absolutely, and an inspiring source of joy for all of us. That actual connection. So we really appreciate that. Thank you for coming by. Thank you for talking to us about all of these things and giving us these insights. And we're gonna have to have you come back on to talk to us about 50 years and how you stay happily married for 50 years. That'll be our next visit.
I'll be happy to share some of the pointers.
Absolutely. Thank you so much.
Pleasure, my genuine pleasure, Andrew. Thank you so much.
Absolutely.